Hello, everybody. My name is Pablo Boczkowski. I'm a faculty member at Northwestern University and the director of the Center for Latinx Digital Media. Thank you so much for joining us for today's weekly virtual seminar of the Center. It is really a pleasure to have you with us. The mission of the Center is to create knowledge about digital media in Latinx and Latin American communities across the Americas. Today's speaker is a leading scholar in this space. Amy Gonzales is an associate professor in the Department of Communication at the University of California, Santa Barbara. Jose Luis Quintero Ramirez, a doctoral candidate at Northwestern University and an affiliate at the Center for Latinx Digital Media, will introduce Amy in just a minute. I am delighted to note that this quarter, our series is co-sponsored by the Alice Kaplan Institute for the Humanities, the Buffett Institute for Global Affairs, the Center for Global Culture and Communication, the Department of Communication Studies, the Department of Radio, Television and Film, the Latina and Latino Studies program, and the program in Latin American and Caribbean Studies. But before we go to the seminar, I would like to start by acknowledging that Northwestern is a community of learners situated within a network of historical and contemporary relationships with Native American tribes, communities, parents, students, and alumni. It is also in close proximity to an urban Native American community in Chicago and near several tribes in the Midwest. The Northwestern campus sits on the traditional homelands of the people of the Council of the Three Fires, the Ojibwe, Potawatomi, and Ottawa, as well as the Menominee, Miami, and Ho-Chunk nations. It was also a site of trade, travel, gathering, and healing for more than a dozen other native tribes, and is still home to over 100,000 tribal members in the state of Illinois. It is within Northwestern's responsibility as an academic institution to disseminate knowledge about Native peoples and the institution's history with them. Consistent with the university's commitment to diversity and inclusion, Northwestern works towards building relationships with Native American communities through academic pursuits, partnerships, historical recognitions, community service, and enrollment efforts. Let me say briefly about how the seminar will unfold. First, Jose Luis will tell us more about Amy's research and career in just a minute. Then Amy will deliver her seminar. After that, we will open for questions. Please enter your questions in the Q&A function of the webinar at any point in time. Jose Luis will moderate. At the end, we will deliver some closing remarks. Once again, many thanks for joining us. And without further ado, Jose Luis, the screen is all yours.
Thank you so much, Paulo. It is a great pleasure to introduce Dr. Amy Gonzales. Dr. Amy Gonzales is an associate professor in the Department of Communication at the University of California, Santa Barbara. Her work examines the digital divide, particularly short-term disruption in access to devices, as well as the effects of social interaction via communication technologies on well-being. She is especially interested in these phenomena for people from disadvantaged communities. Her work aims to advance theoretical understanding and real-world solutions that may help mitigate the long-term consequences of new digital infrastructures that may otherwise exacerbate social inequalities. Her work is published in leading journals in the field of communication, including the Journal of Communication, Communication Research, New Media and Society, Journal of Computer-Mediated Communication, Media Psychology, Computers and Human Behavior, Information, Communication and Society, and Cyber Psychology, and Behavioral and Social Networking. Please join me in welcoming Dr. Amy Gonzales.
Hello, everyone. Thank you for being here, and thank you for giving me the time. Pablo, thank you, Jose, for the lovely introduction. I'm so excited to be engaging with this community, and I'm going to give me 1 second as I share my screen with all of you so I can jump right into the content. And of course, let me tweak this. 1 second. There we go. So as I said, I'm so excited to be part of the seminar series for the Center of Latinx Digital Media. Today's talk is meant to really illustrate the two sides of my research, which I like to say, on the one hand, first explores how people, especially those from marginalized communities, can use digital technology to enhance quality of life broadly through social support, self-expression online, et cetera. And then second, given these possible benefits, what happens then if access to those technologies is disrupted? So to put it more simply, in other words, how do people connect with digital technology? And then what if they can't, right? These are kind of the two sides of my research coin. So I'm gonna try to focus the talk around a study that exemplifies each of these, starting with this question of how do people connect with digital technology, right? Again, a very simplistic version of a long studied and complicated question, of course, but my recent way into this question has been through the social diversification hypothesis. And the basics of this proposition are that the internet acts as a vehicle for overcoming existing social inequalities in access to information and social networks. In other words, when this concept was developed, Gibraltar Mesh, who works out of Israel, was particularly interested in kind of differences in how Arab Israelis and Jewish Israelis were using the internet for networking purposes in different ways, given their status within Israel. And in fact, the first couple of studies to come out of this line of work found that Arab Israelis were more likely to be broadening their networks online, whereas Jewish Israelis were slightly more likely to be emphasizing the kind of close tie networking online, right? Reinforcing of existing ties. They also found that Arab Israelis were more likely to search for health information than Jewish Israelis online. So again, kind of taking advantage of the ways in particular that the internet can compensate for geographic segregation, kind of physical segregation away from resources for kind of marginalized communities within a given space, right? And it just so happened when I kind of stumbled upon this work that I actually had been living in Philadelphia, which is itself a highly segregated city. So this is slightly dated data that was approximately, census data that was came approximately from when I was living there. And what you can see here is that the blue dots represent Black African-American residents. The yellow dots are Latinos. The green dots are whites and the red dots are Asians, gray dots are other. And as you can tell, and for any of you who have spent any time in Philadelphia, you can see that Philadelphia is highly segregated. And of course, this is especially problematic because, as is often the case, that racial segregation, racial and ethnic segregation, maps onto socioeconomic segregation. So what you can see here is the same map on the right, also from census data, but looking at median incomes across these neighborhoods, again, within census tracts here. And the lightest green census tracts are the most disadvantaged. So these are people living with a median income of under $25,000. And then you see more wealth as the darker green, the depth of the green increases. And so what you can very strikingly see, right, with these data is just how closely kind of socioeconomic advantage maps onto the racial and ethnic composition of a neighborhood. And so I happen to have data from these neighborhoods that came from a diary study that allowed me then to do some interesting tests of the social diversification hypothesis in Philadelphia. So at the point at which I conducted and published this study, and this study is a bit dated, I'm actually at the end of this going to talk a little bit about subsequent work that I've been doing to kind of expand this out. But at the time, kind of the key hypothesis was that African Americans and Latinos, and then also those with no college experience, so I kind of both looked at racial and ethnic differences and also educational differences, that those groups would be more likely to be using the internet for more diverse exchanges online compared to offline, whereas whites and Asians and those with some college experience were more likely to have more diverse exchanges offline rather than online. That the internet is really a place for those more advantaged groups to kind of, again, reinforce existing ties with that have kind of primary sources of capital. Now, I want to point out really briefly here that Asians within the US is an incredibly socioeconomically and ethnically and racially diverse population, right? Of course. And so, and historically, kind of nationally representative data, especially at Pew, which I use a lot, does not do a good job of representing Asians. The reason that in my specific sample, I've lumped them with the more advantaged groups is there's some good data out of AJS, some sociological data that demonstrates that Asians who are college educated within the US tend to have wealth that better approximates whites. on average. And it just so happened that in my sample, these were all college educated students, it's a population. So to move back then to kind of the contributions of this kind of larger test, compared to the work that had been done on social diversification at this point to date, one contribution was, again, to be testing this in the US, because most of it had been done in Israel, but also because what I had were diary data, and I'll elaborate on the data collection in just a second, I was able to actually compare online and offline diversification practices. So at that point, most of the data had also been survey data and had simply asked people, what are you doing online? And then compared the online activity of advantaged and different disadvantaged groups. But I was actually able to test kind of some of the details of the proposition that hadn't been tested, which is to say that those differences should not only be different between groups online, but also how people within these groups and engage their ties online versus offline. You should also see a difference there, right? And the reason I was able to do that with this diary data is because I purchased the last 20, oh my gosh, my brain, I'm sorry, I didn't get very much sleep last night. Why is my brain dying? This is so old. Palm Pilot, thank you. It's so old and no one uses them anymore that I actually forgot what they're called. The last 20 Palm Pilots on Amazon, I actually think this is true. In fact, I used this software that had been designed for Palm Pilots, and after I spent a couple $1,000s for this kind of data software to help me collect survey software, the guy closed up shop because for those of you that don't even know what a Palm Pilot is, right? It's like an early digital tool that was kind of pre-cell phone, what people were using to essentially like a daily planner, right? But the reason that I used these Palm Pilots, it's so embarrassing and kind of hysterical, but it was because they were allowing me to log these data, digitally, but without enabling any sort of additional digital interaction, like internet-based communication, right? And so I created these little, to give you the visual of it, we had people come into the lab and actually fill out on a computer kind of some self-report baseline data, but then gave them these Palm Pilots that were pre-programmed. And so in addition to filling out surveys at the end of each day, they had pre-programmed 10 surveys each day that would go off, so that an alarm would go off at a random time. And when that alarm went off, they were supposed to fill out one of these surveys. And so we were truly able to randomize this kind of daily diary collection. And what they were supposed to do at the time was to answer a series of questions about their two most recent social interactions. And then they came back into the lab and completed some data on kind of social support and self-esteem. So this is the key to what I'm actually going to be presenting today. All of the data came from these diary data, these daily surveys. And what I ended up with after kind of dropping out the bad data, right? We could go in and see when people were just kind of randomly filling these out inappropriately. And so this is the benefit of having these digitized. And ended up with 76 people who completed or reported on over 2,600 social interactions. About 15% of those were online in some capacity. Most of those were email, Facebook, or instant messaging at the time. And then paid people $90 for their kind of week of participation in the study. The primary independent variables in this study then were kind of racial and ethnic status, African Americans and Latinos being disadvantaged, and the more advantaged groups, again, being whites and Asians, and then also kind of separating out those that had some college and putting those into the advantaged educational group versus no college training. And then the primary dependent variables here from a social diversification perspective were, first of all, was the interaction a weak tie exchange? And the way that I actually measured that was at the point at which people came into the lab, I actually had them fill out a measure of social support, of emotional social support that asks people to list, just using initials, the number of people that they have that they can talk to about difficult decisions if they're going through trying to, struggling with some sort of emotionally burdensome experience. Do they have someone they can turn to? And then they actually listed those initials on an index card. And then we gave them that index card for the week. And then because of course these surveys that are coming up had to take place very quickly. One of the questions was, when you're reporting on this exchange that you just had and whether or not it took place online or offline, what was the quality of it? That was kind of a key question that I was originally trying to target. But we also asked, was that person on your index card? So it was this quick and dirty, but also consistent measure of whether or not this was a close tie versus what we would then otherwise deem a weak tie. So if they weren't on the index card, this was presumed to be a bridging tie or a weak tie. And then the other question that we were able to ask was the presumed race of the person that they were interacting with. And so this was a different operationalization of diversification, was instead not just was there a bridging activity, but also did you see that manifest through an interracial tie versus a same race interaction. So the data then became analyzed using kind of an odds ratio analysis. And what we looked at then was the probability of having a weak tie interaction by then their racial and educational status, and then of course by channel. And so what you see here is that for those people that were in the disadvantaged groups, racial and ethnically, and then also by education, a very large percentage of their online communication was indeed spent engaging with weak ties, right? Not people close to them. Whereas offline, you see quite the opposite, right? This is a very dramatic difference, that offline, most of their interactions are with people that are, well, not most of them, but many of their interactions are still with people that are in their close network. And then, somewhat more or less as expected, for those that are in the advantaged group, you really don't see a difference, a dramatic difference. You do see a little bit more of these weak tie interactions offline compared to online, as we would expect, but this is not statistically different. But this overall interaction is not surprisingly statistically significant. And is consistent with the social diversification predictions. We see the same thing here if you look at racial and ethnic exchanges, but only not based on education, but only based on race. So again, for African American and Latinos, they were more likely to be engaging in cross-race or cross-ethnic interactions online compared to offline. And then you see the opposite for whites and Asians. So these data, again, validate the social diversification hypothesis in the US, but also with this real-time data that had not previously been tested. So methodologically, it was a real contribution. But of course, as good research often should, left me with additional questions about really kind of the finer grained process, right? And so as I explored the data that had kind of has since evolved in this area of work, what's become clear is that there's this kind of tensions between the capital, the social capital that individuals already possess within their network, and then of course the capital that they're aiming for. In other words, it's one thing to say that marginalized individuals will or should or can use the internet to try to broaden their networks. But what happens if they don't have consistent access to technology or the same rates of digital literacy that would allow for them to do that, right? What are some of the moderating effects or some of the the factors that might temper this ability? And in particular, this was interesting to me because if you look through these data, you see some mixed effects through the work. And so what I then have done is with a host of colleagues, African-American and whites, actually, we together in pairs interviewed, Black-white pairs, interviewed high and low income whites, and then African-American and Latinos, and asked them, who are you engaging with online? What's that process like for you? And really tried to get at kind of qualitatively some of these mechanisms. And this is actually a study that is hopefully going to go out for review very soon. But kind of to summarize this very, very quickly and then move on to this kind of other body of my work on the digital divide, what we found, perhaps not surprising, was that it was really the low-income whites and the high-income African-Americans who were the most engaged in this process of trying to broaden their networks. And I think this is because high-income whites were least motivated to do it. They did it some, but were certainly the most apathetic about it. And then low-income African-Americans and Latinos were so extremely marginalized in some cases that they didn't really have enough capital to kind of bring to these exchanges. But even across these two groups that did seem to be really kind of actively engaging in network building, they went about it very differently. And that's because they have very different levels of digital access, but also trust. So low-income whites were very comfortable engaging with strangers online, whereas people of color in both groups really were much more selective about building these networks and very frequently kind of turned to some sort of vetted tie because trust is such an obviously key factor within these communities. And so kind of the conclusions that I'm drawing from this to kind of synthesize very briefly is that trust and digital access, I think, are really important moderators of these social diversification processes. So I'm happy to talk more about this work if anyone's interested, but in the interest of time, I want to kind of give you this other side of my research, which is if I've kind of invested in trying to understand how technology can provide improved quality of life and social supportive resources, it then eventually became clear that there's obviously very really real consequences if people can't always access these tools, right, which are increasingly essential. So this work actually came out of an attempt to do an intervention in public housing in New York City. I was actually living in New York City at the time, and I got the idea of taking some of Keith Hampton's work on kind of that looks at kind of the internet as a tool for building community, neighborhood community, and kind of ties within community, and tried to take that to a small screen intervention. In other words, a lot of his work had looked at kind of building web platforms for community groups and found this to be a successful way to allow for bridging ties within community. And I thought, well, not everyone has a laptop, but everyone has a phone, right? Of course, everyone has a phone. And so using these like lowest common denominator technologies would be the way to help provide such tools to the communities that were most in need of building community, right? There's good research that finds that low-income neighborhoods can vary in the degree to which they have kind of network support within their community, but those that have the least actually suffer the most, and that there's actually direct ties to kind of those neighborhoods having worse health and more crime. And so in anticipation of this intervention, I went in and did interviews with a team of graduate students from Columbia, actually, in public health department, and talked through how people were already using their phones and asked them things like, well, are you using your phone to connect with your neighbors, right? And what I ended up finding was answers such as, well, sure, I miss it when I don't have my minutes and I can't afford to buy them. But today I put $10 on one of her phones, and the other one turns on the 13th. And I feel like naked. I feel like, wow, gee, I need to talk to somebody. There's nobody, and when I don't have my phone, I talk to my cat Rambo. Now, I'll tell you that this is kind of one of those beautiful moments of why qualitative research is so important, right? Is we didn't go in looking for digital disruption. We kind of assumed that, again, everyone has their phone on, which is of course completely stupid, but it became really clear that cell phone access was much less stable than I previously realized. And a lot of these people were relying on lifeline phones, which are government subsidized phones. And I can talk more about those at the end if anyone's interested. At the time that I was collecting these data, only 5 states were actually providing these phones. Now all states provide them, and they actually provide many more minutes than were originally available. But at this time, New York was one of those states, but they were only providing 250 free minutes. So that meant quite often people would bounce back and forth between 2 different phones. And when one phone ran out, they would have the other. Prepay phones, of course, opened the world to people who don't have the credit for phone plans. So they increased the number of low-income users who had cell phones, but it meant that they weren't always consistently able to keep minutes on those phones. So in recognition of this problem and this concern that we have a new version of phonelessness in this country, which is kind of often flying under the radar because it's intermittent, because people don't have landline phones anymore, right? 70% of us anymore don't have landline phones. So I became concerned with the consequences of kind of intermittent disruption to technology and cell phones in particular. So subsequent interview studies, I found things like people saying, yeah, I don't have minutes all the time, and then employers can't call me as much. And if they can't get a hold of me, they're gonna call somebody else and they're gonna do the job. And that's where I feel lost. So lost employment is actually one of the most common themes I see in this work. The people who have the problem keeping on their phone are the same people who actually often do shift work jobs, part-time jobs, and need to be available, right, to pick up these shifts. It also, disruption interrupts social support. So this man, Barry, said, when dad passed, the relatives, they're mostly in another state, and I couldn't call them, I couldn't talk to them. I really didn't know. I wasn't happy. I was grieving, and I know they were, and I felt really disconnected and lonely. And often what happens is people in these communities who don't have stable access to their phones or technology, also others in their network don't have access. So by the time Barry's phone was turned on, his daughter's phone was off, and he didn't know how to get a hold of her. So I've kind of labeled this phenomena as one of technology maintenance, and identified that, of course, this is not a novel idea, but to kind of really kind of claim the import of that continuous work that's required to stay connected, and to also acknowledge that low-income users are more likely to be relying on technology that's broken or borrowed and shared, or just dependably unstable, kind of cycling through these periods of disruption. And so in addition to some of these qualitative studies that I've just described, I've also done kind of collected smaller surveys, non-representative surveys, to try to operationalize these initial qualitative questions and validate some survey questions that get at this disruption, and found associations with things like worse grades for university students, higher stress levels, both for students and for chronically ill patients, and generally poor quality of life for people who experience this disruption. And I'll just say, for me, the reason I think technology maintenance as a digital divide issue is so important is because, although there are still, as we've realized during COVID, very striking disparities in things like in-home broadband access or access to devices, increasingly we are getting, we're saturating the number of users who at least own some sort of device or even will have in-home service. But I think it's important as we do that to recognize that the quality of that access is not as stable in some populations, and that over the next few decades is going to be kind of the key first level digital divide problem. I think as initial ownership and access is gained, the kind of stability of that access needs to be tested. So this last study that I'm going to show you some data from actually then looks at causality. So I looked at qualitative data and I looked at survey data, but what I was missing was a test of causality to determine whether I could see this causal effect of having reliable access as a key factor in improving quality of life for a vulnerable population. And so with a massive team of graduate students, we did a field experiment, a longitudinal field experiment, where we tested kind of this key hypothesis, which was that participants that would receive some sort of stable monthly cell phone service would show improvements in self-reported health and well-being over that, in this case, it was a 6-month period, compared to those in a control condition. The only other kind of key factor of interest in this study was trying to understand some of these mechanisms and knowing that social support might be a key moderator. So social support, as I've kind of alluded to earlier, is really essential for health. There's decades of research that finds that those of us that have more social support and better quality social support have fewer accidents, we contract diseases at lower rates, and we actually live longer. It's some pretty impressive and kind of, especially in the moment of COVID, when we've all been lacking in social support, I think kind of very striking data. So there is, of course, kind of evidence within the digital divide and even kind of CMC literature that finds both rich get richer and poor get richer benefits of digital support. But in this case, we were predicting that those people who have the least amount of support might then benefit the most from having the stable access to technology. And this is consistent with some other work on especially the kind of emotional benefits and supportive benefits of access to technology. And so we predicted this then second hypothesis that reflects this poor get richer effect, which is the amount of emotional support should moderate the relationship between stable cell phone access and quality of life, such that those with less support should actually have more improvement or see more benefit. So Again, we randomly assigned participants to receive either stable cell phone service in the treatment condition, or what we did was want to make sure that any effect was not simply due to receiving some sort of increased financial support, right? And so then what we did in the control was gave roughly the same kind of monetary value that we were giving on the phone cards, which were just prepay phone cards, along with the phone. If people needed the phone, we also provided the phone. So we didn't compensate for that in the control, but most people were just getting the regular phone cards. And so then we also gave a financial equivalent of that in the form of a gift card to a grocery store, local grocery store. The sample, at this point, I was living in Indiana, which is where I was before coming to UCSB. And so these were very low income residents in Indiana who we recruited by reaching out to homeless shelter, also an HIV clinic where I had done previous work that mostly serves low income clients, and reached out to caseworkers who then could identify clients who were kind of stable enough. Many of these residents or clients struggle with addiction problems or serious mental health problems. And so we needed to find people who were seriously in need, but had enough stability in their life to participate in the study. And so the caseworkers basically reached out to those individuals, asked if they were interested in being contacted by us, and then got their information and passed it along to us. And then we recruited that way. The data then involved finding people, and all of the data, just to be clear, were collected not online, but with paper and pencil, of course, given the specifics of the questions at hand. And so we got a month of baseline data just to understand, people's kind of current status, and then 6 months of treatment data, where the key dependent variables were overall self-reported health. This is a very well-validated self-report measure that is consistent with, or consistently correlated with physical and mental health. And then I used a World Health Organization quality of life measure, which gets at environmental quality of life, which a key question in there is kind of access to important information. Also physical, psychological, and social quality of life. And then again, the moderator is a measure of perceived social support. I'm happy to talk about the specifics of that, those questions as well. The sample, this is just an overview of the sample, which I think is especially important to kind of discuss because it varies dramatically from your average student sample. So what you can see at the top here is that the median income in this sample across the two groups was $11,000. Now, quite a few people didn't mention what they made, but they are very low income. I know that seems insane, although for those of you that are living in the Midwest compared to California, you can understand how in a place like Indiana, where I was living, this is an income that people can barely scrape by on, right? Barely. The average age of the sample was, much older than your student sample, 42 years old, and is predominantly white. So 66% of the sample was white. 9 participants were African-American, and then there was 1 Latino and 1 Native American, and then 6 identified as mixed race. The average-ish education was somewhere between high school and some college, and then it was somewhat disproportionately male. The other kind of key kind of demographic factor, though, that I want to point out here is if you look at the very bottom, you'll notice again that only 1 of these participants actually had a landline. And again, that's actually quite consistent with, at this point, most of the population. But I've been tracking this for the last almost 10 years now. And kind of the general population is kind of caught up with those living near the federal poverty level, but they've always dropped landline service before even the rest of us, because of course, if you're paying multiple bills, why would you continue paying your cell phone bill and your landline bill, right? And the reason I think this is really important, again, is because that means that when you lose cell phone access, you lose your ability to call your doctor, your neighbors, your family out of state, your employer, et cetera, right? You lose your cell phone, your phone service, because this is our phone service these days. And so, and again, this population, which is most likely to lose that service, is also, I would argue, in many ways, most dependent on kind of regular contact with kids' schools or caseworkers, things like that, right? Kind of institutional network support is often really essential for these communities who are often lacking in kind of personal social support. So what I'm now going to show you then, and kind of close the talk with, is the data of the self-reported health and these self-reported quality of life outcomes over time for each group. And what you're going to see is the change over time in health and well-being for each condition, also broken down by those who had low, medium, and high levels of social support. So you can also see this moderating effect. So over on the left is the control condition, and over on the right is the treatment condition. So again, those the red line represents those that had the least amount of social support. The blue are those that have middle amounts of social support, and green are those that have the highest social support. And what you can clearly see here, and I'm happy to kind of talk through some of the possible alternative explanations for these data, because I've played around with this in a variety of different ways. But across the board, what you can see both with the self-reported health and then also for the quality of life outcomes is that you see a slight decrease in quality of life, or essentially very little change for those in the control condition. But over the course of the 6 months in the treatment condition, you see an improvement in outcomes and quality of life outcomes and health. And then you can see that those improvements are the most dramatic for those that have the least amount of support, right? So if you only have 1 or 2 people to rely on when things are really tough, being able to talk to those people becomes incredibly essential. And I'll just point out that we had clients in this, participants in this study who had really intense hardships that took place during our study. We had multiple people end up in the hospital for one in a car accident. I forget the reason of the other person. And then we also had one woman who had a baby during the study. And in all 3 of those cases, and even in the case where the woman had the baby, the grad student who was kind of collecting data from her on a monthly basis was one of the first people to see her baby, because of course, we didn't want to intrude on people's lives, but she was like, no, I need to have my monthly cell phone covered so that I can send pictures to my family, right? So that I can show this new baby to my network. And so people were just, qualitatively, they shared with us incredibly grateful and just benefited quite dramatically from having this stable access to cell phones, which they couldn't otherwise consistently do. So apart from that, also just kind of qualitative feedback, that quantitative data also bear that out. And in some, methodologically, this kind of fills this gap in this technology maintenance research by validating and elaborating the construct, right? Demonstrating that social support is a key moderator, yet again, in kind of the benefits of digital technology. And specifically when it comes to making sure that we have reliable access to technology. And so, and then I think just filling this kind of, again, methodological gap by demonstrating causality is really important as I continue to try to elaborate this construct and think of proposing some sort of more formal theoretical, kind of social scientific theoretical model as a function of these data. As a function of the kind of the data that I've collected over time around technology maintenance and dependable instability. I'm just going to close briefly by mentioning, and I'm happy to talk more here because I've been doing increasingly more work on kind of the policy implications and the role of policy in helping to ensure access. Right now, I will tell you that, technology subsidies, whether that's internet subsidies, subsidies for access to computers, or this kind of longstanding access to cell phones, which have been around, actually were implemented by Republican presidents. The initial landline service that was developed by Reagan, and then it was W. Bush who started applying those to cell phones. These are kind of currently evolving quite dramatically in the context of COVID, which you could imagine, right? There's lots of new stimulus money that has been thrown, both emergency stimulus money, and then now out of this new infrastructure package, there's money to try to more permanently better ensure in-home access to Wi-Fi and also devices. There's also been some kind of awareness that we can't just focus on subsidizing Wi-Fi or cell phones, but we also need to try subsidizing access to computers. So historically, Lifeline recipients had to choose prior to COVID between whether or not they were going to apply their subsidy to an internet or the phone. I think that that's going to be shifting. And now we'll see that all of this is going to be removed from kind of the Lifeline subsidy, and probably the ISPs are going to start, finding new ways to simply outreach to community members. Often it's through kind of local nonprofits or state actors who then can apply for funds and then disseminate in their communities as they see fit to try to connect individuals. I think the question is what it will look like over the next decade or so is still up for debate. Like how these benefits are really going to manifest in community is really an open question. During the Great Recession, similar monies were distributed, but then the BTOP program, it was called, primarily focused on connecting community centers as kind of hubs. So making sure libraries are connected or schools. And I think that there's this realization post-COVID that money needs to trickle into homes and help subsidize actual families' bills. So we'll see. Thank you so much for kind of listening to that package of my work. And I really look forward to any questions that you have.
Thank you so much for this amazing talk, Amy. I'd love to start with one of my own questions, if that's okay. I'm curious about the relationship between digital literacy and the social diversification hypothesis. In particularly because disadvantaged populations are more likely to fall prey to the economic incentives that exist under all digital networking technologies. I'm curious how you examined the digital literacy skills of these populations, or whether they had trust towards these social networking technologies already. How did misinformation or scams or this kind of digital technology phenomena played a role in your study?
Yeah, it's a great question, Jose. And can I ask what you mean by given the economic incentives of institutions?
Sure. What I meant here is if people are interacting with each other through Facebook, WhatsApp, Instagram, or existing social media platforms, how does the way that their algorithms work to generate funds as opposed to generate, or not only to generate funds, but also to generate social connections, how that financial incentive played a role in how much trust people had with these institutions?
I think what you're pointing to is a question that multiple people have kind of brought up recently with me and elsewhere, which is so pressing, which is this knowledge that kind of digital literacy is such a key factor in combating misinformation and has real world implications, right, in the face of something like COVID, if people are getting misinformation and not going out and getting vaccinated, as just kind of one key example, right? I have, unfortunately, I think this is really an outstanding question. These data don't get at that in a really nuanced way at all. But I want to really reinforce that I think that, you are one of many people who has brought this up. And I do think that this is something that researchers should be working on, are working on, and I need to be working on too. In my case, I was much more focused on kind of interpersonal trust. So kind of understanding, and that's what really came through in the data, was kind of that disparity in, so not trust in the platform per se, or trust in even kind of corporate institutions, but rather that willingness to talk to strangers on some sort of Reddit group or in a Twitter feed, which was something low-income whites were perfectly comfortable with, whereas people of color were much more likely to not so much explicitly divulge, well, I don't trust strangers, but simply to very much demonstrate, well, I talked to a friend of a friend, my cousin's an accountant, and so he gave me the name of someone in my neighbor, in my state. Or so it just became really clear that this kind of there's a sociological term for people of color doing this in person, called selective solidarity, kind of selectively building networks when the reality is there's actually very low interpersonal trust in low-income marginalized neighborhoods within the community, and then of course towards people outside the community, for lots of different reasons, but I think primarily resource scarcity and historical racism and exploitation, right? So that's a whole different answer than the one you were actually looking for, but I think it's a good question. So yeah.
Thank you so much. And it helps to clarify exactly what you're meaning about how trust was measured in the study, which is one of our audience questions already. We have another quick audience question. People are wondering if you could repeat the name of the initiative that sought to connect community centers, but then realized that they needed to provide financial support to individuals as well.
Yeah, so the original, let's see, I'm going to look it up for you. The original funding, I know the acronym, which was called BTOP, Broadband Technology Opportunities Program. So it was approximately $4 billion in grants that was distributed, again, along with lots and lots of other stimulus money post Great Recession. And I probably oversimplified. It's not like someone went, hey, we really screwed that up. I just, at the time, the kind of, again, I'm speaking a bit out of turn because I am not a policy expert, but my observation from kind of review of the research on the topic is that, and kind of reading through the policy evolution, is that there was really historically in the US and elsewhere been an emphasis on trying to kind of get as much bang for your buck. So kind of investing again in libraries and schools. And I think, right, COVID really shows that those aren't always sufficient if you can't go to school or to the library, right? There's a whole new kind of geographic organization, if you will, as a function of COVID. And the reality is our dependence on these technologies to do everything was naturally increasing, even apart from what COVID kind of just like, steroid injected by getting us to do everything online, right? We were already moving there. And so I think, anyway, sorry to wander on, but that's the name of the original program. And I don't want to assume that it was like a failed program in any way, just a different goal at the time.
Perfect, thank you. Now we have another question from the audience, and this will touch back on the concept of trust. Folks are wondering if you can elaborate a little bit more on the impact of trust as a moderator of a social diversification hypothesis. I know you already mentioned interpersonal trust. People are wondering also whether how one might begin to measure institutional trust or other kinds of trust.
Yeah, I mean, this is again a great question, and so let me just show my cards, right? We went after these kind of mechanisms, not necessarily thinking that trust was going to be as important as it was, but as qualitative data often do beautifully, right, is they kind of lead you to new insights. And so, unfortunately, we didn't ask about trust, even qualitatively, from kind of many different nuanced directions. It just became clear from the data that it was really important to people, and that lack of trust was really a key tempering of why people would kind of actively bridge. And it's so logical, right? For good reason. And then when we went back and looked through the other kind of mixed results across social diversification research, you can kind of see trust as a reoccurring theme. So again, I don't know how well I can answer that question from my own data. I think if anything, whoever that is, I'm happy to reach out and talk with you about kind of the next study that needs to evolve, right? I've been working with, I will say, in a different capacity, not on this project, but oh gosh, again, her first name is escaping me, even though I'm working quite closely with her, but her last name is Dillahunt. And she's a scholar in the School of Information at Michigan, University of Michigan. And her work primarily looks at the uses of technology for capital building and kind of increasing employment opportunities in the Black community specifically. And she has also repeatedly found this, like, so as someone who designs new technologies, tries to implement them as a means of trying to build capital and build employment opportunities within these communities, just finds again and again that trust and lack of trust really, shapes people's willingness to engage these new technologies. So you might turn to her work as well, and I'm happy to talk more with you offline. There's a huge body of sociological work that I've looked at that talks about lack of trust within communities that shapes, limits people's willingness, at least within the Black community, to make job referrals for one another within the community. So there's a scholar, Sandra Smith, who's now at Harvard, who's looked specifically at trust in this capacity. But again, I hope I'm not just evading your question, because you've spoken to institutional trust specifically. And I think to the degree that institutions also matter, it's also even kind of at an even more macro level, it's this kind of trust in science and trust in technology, given the ways that, again, communities of color have historically been exploited by medicine and science. So I think that there's kind of multiple scales that need to be assessed.
Thank you. And that question was via Laurent Wang, in case they email you, and then you can actually talk about it further on later. We have another question from the audience, and this one is about the platforms in which people communicate. They're wondering if there was a measurable difference by platform. Maybe some people were more likely, or some demographics were more likely to reach each other out through Twitter or Facebook, or like you mentioned earlier, Reddit. Did this play a role in the studies?
Yeah, so I don't know if that person could point to which study they were talking about. In that very first study, that is the one where we specifically kind of quantitatively measured. So the original purpose of that data actually was to measure quality of social interaction across different channels. And I actually have a different study that got published out of there that's in Computers and Human Behavior that found that in the aggregate, over the course of the week, communication that had, when meaningful communication took place over text-based channels, it was more important for improved self-esteem at the end of the week. And I kind of draw on some interpersonal communication theory that talks about the ways that text-based communication can be quite powerful for kind of sense of social connection. So Joe Walter's hyperpersonal model is, and Patty Valkenburg's got some work on kind of the ways that online communication and text-based communication in particular can kind of be positive for a sense of self and sense of connection, but also kind of general well-being. And so I did look at different channel differences and the quality of those communications, again, in a separate piece, but in the studies that I just described for you, I just collapsed across those different text channels and just kind of lumped those all as online communication, in large part because there just weren't enough there wasn't enough online communication. If you recall, it was 15% of the overall interactions that took place. You know, we still mostly interact with people face to face, or again, at least did pre-COVID. And so, you know, it didn't make sense to go in from the diversification test and then try to look at differences across channels. But if you look at other diversification literature, the scholars do sometimes focus on kind of different channels, whether that's cell phones or kind of blogs. So that original Mesh study, I think he actually looks at different channels. You might go back to that and looks at kind of platforms and specifically identifies how platforms that are especially good for bridging, right, were the most likely to be exploited. So I think he focuses on things like blogs and probably, you know, what would be today's, you know, Reddit as well, right? Again, the data are a bit old, but.
Thank you.
That helps. Yeah.
I think it does. Okay, the next question comes via Will Marler, who says hi. And Will says, he's wondering if you could talk about approaching your research across so many different methods. Did you have training in these methods from grad school? Did you largely teach yourself? Or did these come about through collaborations with other people?
Yeah, that's a fun question. I do like different methods. I don't always do them perfectly well. In fact, I often learn, you know, what I've done wrong at the end and then try to fix that the next time. I think in my particular case, so I don't presume to be an expert across these methods per se. I do try to find collaborators, or at least, you know, other people, even if I'm, you know, who can mentor me along the way, or I can, you know, get help with as kind of statistical support. I'm not ashamed of using kind of stats consultants. But also when it came to my kind of transition into doing more qualitative work, I think for me that came out of my postdoc through the Robert Wood Johnson Foundation, which was also really kind of what excited me and motivated me to do work that looked at inequality in particular. And there were just a lot of really amazing scholars in that program who were doing qualitative work. And so I learned a lot from them. We met regularly as a team. And then I took, a few different kind of workshops on trying to do qualitative work. But, I would say I'm also just learning as I go and trying to improve and across these methods along the way. For example, I'm going to try and I found some interesting longitudinal representative data from the CDC that I think can answer kind of a longstanding question of mine. I've been making predictions out of technology maintenance scholarship that what we should see is actually increased phonelessness as a function of increasingly becoming mobile phone dependent, which I think I like this proposition because it's a somewhat counterintuitive, right? The intuitive explanation is, well, the more phones out there, the more people will be connected to a phone. But my argument is because of this intermittent disruption, you might actually see higher rates of phonelessness. And in fact, I've realized that the CDC collects data on phonelessness. It's one of the few places that does, and has done so twice a year for the past decade. And in fact, you see this slow creeping up from 1% of the population to more recently 3% of the population in the number of people that are phoneless. So I've actually found a methods person who knows how to play with big data sets that can help me with that. So yeah, finding partnerships, but also not being afraid of finding the method that's most appropriate for the question you want to ask, right? I think if you're question driven, then you have to sometimes just figure out the best way to do the necessary method to answer that question. So works for me.
Thank you so much. That's both helpful and a little daunting.
Indeed.
Now I'd like to give a chance to some of our affiliates to ask some questions. Facundo, I believe you have one. I'll let you.
Thank you very much, Jose. Thank you, Amy, for this incredible presentation. I also really admire how you walk through different methods, and I think this is really cool and important for the field and for also for social sciences. I think that my question is, I really like how you included socioeconomic lenses also like as an important variable to understand like the racial and ethnicity, that the role that race and ethnicity plays in digital access. And also thinking that probably pushing for this intersectional lens, I was thinking and I'm particularly driven by the example that you gave of the woman talking to one of the students about like the importance of like having access or having a broadband at home. I was thinking if you found evidence of like gender practices in between like the different studies that you conducted. And the second one is also thinking about the macro variables. If in your data, age has a role in explaining how like, well, one of the studies is conducted within like students, but I was thinking particularly in the experimental design, like how gender and age plays in your data. Mm-hmm. Thank you again.
Yeah, those are both really good questions. I just taught my first digital divide class, and I know that to undergraduates. And so obviously age is like one of the most consistent predictors of kind of digital divide outcomes, and gender, especially across the globe. I was kind of shocked to learn myself as I was teaching the class is still really a really consistent predictor, right, of disparities, especially in the Middle East and throughout the African continent. But having said that, I actually didn't look at these with a lot of precision, primarily because I didn't, and I should just own that. But specifically with respect to the experiment, the sample sizes are so small, right? I only have 25 in each condition, so I just don't have a lot of power. And so I think it would be almost impossible to statistically, I think, look at gender differences in that study. Now, just because the differences then between conditions, also looking for, differences by gender or age are really small. And I don't have a lot of, the problem is with respect to age, which is, as we just kind of noted, perhaps one of the most important factors, there's just not a ton of variance in most of my studies, because I've either looked at students or in that experiment, older people. Probably where I could have looked at the most variance would be that first one. I did actually in that social diversification, but I don't think I have looked. The short answer is that's a really good question, and I don't have an answer because I haven't looked. myself. I will say with gender, it's something I do think that we've talked about with that most recent qualitative data, because we, in addition to kind of parsing out cells by race, ethnicity, and income, we did also try to look at differences by gender. And I think so we're also, when I collected that data, I collected it, we collected the interview data for multiple purposes, and one, which is completely different, which was we asked people about their relationship to using mobile technology in police encounters and how they felt about it and whether they'd had experience with it and whether they thought that was dangerous or good for police or the citizens. And looking at how people answered that by race and socioeconomic status was fascinating, but we also see some interesting gender. I think gender might play out a little bit there. We're still kind of analyzing those data. So long answer, but and not a good one, I apologize.
No, thank you so much.
A great one, Amy, and a great talk indeed. So thank you so much for sharing your very important and very interesting research with us. It's been a pleasure to have you close the fall quarter speaker series of the Center for Latinx Digital Media. So thank you so much. Thank you, Jose Luis, for outstanding moderation as always, to our audience for staying with us through the end. And I hope everybody has a great break, and we will resume the first Thursday of January with the winter quarter series. We're gonna post the lineup very soon on Twitter and on our website. So I invite you to join us for our first talk, Catalina Dionís, on January the 6th. Until then, have a great time.